Can dizziness come from the neck? More specifically, is your dizziness coming from your neck? Providing you with pain relief strategies and wellness solutions for modern day living. In this video, I'm going to show you a few things you can test at home to see if your dizziness is caused by a problem in your neck. My name is Dr. John Saunders. I'm a chiropractor in Newmarket, Ontario, Canada. I've been in practice for almost 18 years, helping people recover from problems that stem in the neck, specifically the upper cervical spine. Dizziness or vertigo can be debilitating. I've seen it cause depression, anxiety, panic attacks, and it simply affects your quality of life. There are many things that can cause dizziness or vertigo. Cardiovascular issues, high blood pressure or low blood pressure, problems in the inner ear. We've talked about this in another video with the utricle causing BPPV, viral infections, vestibular migraines, Meniere's disease. These are just a few things that can cause dizziness or vertigo. One thing is certain, you need to find the cause of your problem. In some cases, dizziness or vertigo can be a medical emergency. So if you're unsure about the cause of your dizziness or vertigo, or if it's new or has a sudden onset, please seek appropriate medical intervention. In order to determine if dizziness is coming from your neck, there are a few things that can help determine whether or not the cause is in your neck or somewhere else. One of the most important things you can do is determine what you feel like. Cervicogenic dizziness or cervical dizziness or cervical vertigo has a specific symptom pattern, meaning one of the most common complaints of a cervicogenic dizziness patient will be a feeling of lightheadedness. They could also describe their feeling as a drunkenness state, feeling like you're going to faint, a fogginess, feeling like you're going to fall over, postural imbalance. These are all symptoms or common complaints that we get when someone's describing cervicogenic dizziness. Another thing that can determine whether you have cervicogenic dizziness or not is, do you have neck pain? One of the most common things that need to be associated with your dizziness is neck pain, neck stiffness, movement issues, decreased range of motion, maybe sounds when you move your neck, that grinding sound. These are all common symptoms or signs that a patient with cervicogenic dizziness will complain about. Cervicogenic dizziness is not an easy diagnosis. In fact, it's a diagnosis by elimination. And what I mean by that is after you've ruled out infection, cardiovascular causes, inner ear problems such as BPPV, these need to be ruled out prior to a diagnosis of cervicogenic dizziness. Before I go through a few tests that you can do at home to see if your dizziness is coming from your neck, I just want to take a minute to discuss how dizziness can come from your neck. With proprioception in the upper neck, there are mechanoreceptors that need to provide the right information back to the brain about your head position and movement for you to be able to maintain proper balance. These mechanoreceptors are in very high concentration in the upper part of your neck, especially in the suboccipital area, the area around CO, C1, and C2. If these mechanoreceptors are injured, or if they're fatigued, or if they're inflamed, they will not do a good job at relaying the proper information back to the brain, and you will experience cervicogenic dizziness. The tests I'm going to show you are a modified version of something that we would do in an office setting. They'll give you an opportunity to challenge the mechanoreceptors in the top of the neck to see if you can reproduce the dizziness from your neck to determine if your neck could be causing your problem. The first test is called the head-neck differentiation test. This is where we're going to challenge the range of motion and the movement in the upper cervical spine while we're taking out the visual system and the inner ear. With this test, we want to primarily stimulate the upper cervical spine and the mechanoreceptors that are located there without any visual input or inner ear feedback. If you have an office chair that will swivel back and forth, I'm sitting on a stool right now, which works fantastic, but the same would work for a task chair or anything that you can rotate back and forth. So for this test, we want to only cause motion in the neck. In order for this to be effective, we're going to close our eyes and we're going to keep our head straight forward, and we're going to rotate our body and trunk while we keep our head forward. And you want to close your eyes and you want to go back and forth while keeping your head straight forward. And what this does, this allows your visual system with your eyes closed to be taken out of the picture, and with your head not moving, it shouldn't stimulate the inner ear. And continue to do this at least until you feel some dizziness. If you don't feel dizziness, this does not exclude cervicogenic dizziness, but this is a very good test to try in the comfort of your own home to see if you can elicit any dizziness. Another test that you can try in the comfort of your own home is a cervical joint position error test. We're going to do this test in 3 different ranges of motion: rotation, lateral flexion, and extension and flexion. And what we're going to do is we're going to close our eyes and we're going to move our head from side to side. If you start to feel dizzy, then you can stop. But what you're going to do before you open your eyes, you're going to try to put your head where you feel center. And you're going to open your eyes. This is best done in front of a mirror. What we're looking for, if you have an error in coming back to neutral, meaning when you open your eyes, you were looking to one side or the other, this could indicate there's a proprioceptive issue in the upper neck. The same thing with lateral flexion. We're going to close our eyes. And what we're looking for when you open your eyes, we want you to be neutral. We don't want you to be off one side or the other. Again, a mirror is really good to do this in, so you can see if your head is back to its neutral position. And then finally, flexion and extension. Again, we're going to close our eyes. You can continue to do this for 10 seconds or until you get dizzy, and then you put yourself where you feel center is. What we don't want you opening your eyes and you're in slight flexion or slight extension or slight lateral flexion or slight rotation. This could indicate that you have a proprioceptive issue in your neck, and that could indicate that your dizziness is coming from the upper cervical spine. Another easy thing that you can do at home to see if structures in your neck are contributing to your dizziness is to palpate the muscles. So the muscles you want to palpate are at the back of the neck. You just want to push if there's tenderness, if any of the tenderness areas elicit your dizziness. You can go into the top of your shoulders. This is called your trapezius muscle on both sides. Hold it. If you find a nodule, like a trigger point, then you can kind of put some pressure through that. If it's tender or elicits a dizzy response, that could be an indication that some of your dizziness, again, is coming from your neck. Finally, if you have an x-ray, or if you've never had an x-ray, that might be something you want to check out. An x-ray is good because it can tell us, do you have any cervical disc damage, degenerative disc disease, do you have any osteophytes, or evidence of an alignment issue. One thing I see commonly in our office is a loss of cervical curve or a kyphotic curve where the neck starts to come forward. So in this x-ray, you can see this neck has not only lost its normal natural curve, but it's actually come forward and reversed its curve. We call this cervical kyphosis. And in fact, if you look really closely at C5 and C6, there does appear to be some mild degenerative disc disease. And again, this is something we often see associated with people that have cervicogenic dizziness. So it just gives us one more piece of the puzzle. If you have a question, please put it in the comments below. I enjoy answering all your questions. So in summary, if you have dizziness and you're not sure where it's coming from, the first and most important step is to rule out any other potential cause. The second thing to determine whether dizziness is coming from your neck is, do you have pain in your neck? Do you have stiffness? Can you palpate or push and feel painful areas in some of the tissues in your neck? Does your neck grind when you move it? Is it limited in range of motion? This would be a qualifying factor for cervicogenic dizziness. Number 3, can you reproduce any of your dizziness with the tests we just went through? Number 4, have you had any previous trauma to your neck or head? A concussion, an old sports injury, even a car accident many, many years ago? Do you sit in front of a computer for long hours that will fatigue the mechanoreceptors in your neck? Do you know that you have forward head posture? All of these things can qualify a diagnosis of cervicogenic dizziness. And finally, If you know you have cervicogenic dizziness and you're struggling with it, be patient. This is a condition that takes time. Seek the professional opinion of a professional like a chiropractor who has experience dealing with cervicogenic dizziness and upper cervical conditions. If you haven't already, I'd really appreciate it if you hit the subscribe button below so you can be informed of new videos. If you haven't yet had the opportunity to watch this video where I show you some exercises to help you get rid of your cervicogenic dizziness in the comfort of your own home, please click this video and watch it right now. Thank you for tuning in. I really appreciate your comments, your questions, and I can't wait to see you on the next video.